Hello everyone, I am Dr. Sandeep Kharam. I am a practicing endocrinologist at Asian Hospital, Faridabad. I am in front of you to talk about these new WHO guidelines which have advised against use of artificial sweeteners in people in order to reduce their weight or to reduce future risk of diabetes as well as other cardiovascular disease. Friends, what I am noticing in day-to-day life is that use of these artificial sweeteners, they are going up, and in fact their use has become rampant. Earlier I used to see these sugar-free things or sugar-free sodas and things like that. But now I'm noticing there are even sugar-free mithais are being available. Nowadays I'm seeing in day-to-day uses there are jellies, bakery products, toffees, candies, even milkshakes. They are coming as sugar-free. We should know that there is nothing sugar-free as such. These are artificial sweeteners, but there are a lot of studies which have demonstrated even in past that there are safety concerns with them. Unfortunately, long-term data was not available. But now with this WHO advice which has come up with the background of recent data regarding their harmful effects in non-diabetic patients or healthy adults, I think we need to know more about these individual products, what advantage and disadvantages they have. What general people think about artificial sweeteners is that they are all good. They think that if you are taking artificial sweetener, it will not cause any weight gain, which is true because artificial sweeteners truly are non-nutritive sugars. So they do not have any calories. But we must also understand that once you are using any artificial sweetener, be it be aspartame, saccharin or any other, they do not contain any calorie but they have their own issues. So once you are consuming these agents, they go inside your body, they don't get metabolized, but there are harmful effects which can be seen. There are studies showing, even there were some studies with saccharin in rats showing the increased risk of cancer, which prompted FDA to ban 1970s. However, long-term studies are not there. We also know that different non-nutritive sweeteners or artificial sweeteners of sugars, what we call them as, they have been shown to alter our good bacteria in our intestines. So that has been shown to be associated with increased risk of obesity later on. There has also been evidence suggesting that once you are taking them, your future risk of heart disease may also go up. Even mortality rates may be increased by consuming these sweeteners. These sweeteners, they can have some effect on brain function as well. There is evidence which has shown that they can affect our brain chemicals in different ways, leading on to delayed mental reaction to our day-to-day physical activities and mental alertness. The use of artificial sweetener has also been associated with weight gain. Now to a layman mind, it may appear that now these artificial sweeteners, they don't contain any calories, so how can they cause weight gain? What has been noticed is that artificial sweeteners, they alter our taste receptors in our mouth. Now once the taste receptors are altered, they get stimulated, and that is why a person ends up with it. So once you are eating more, you are getting more calories from other food particles and ultimately you gain weight. Also, it has been seen that artificial sweeteners, when consumed and when they go inside our gut, they are associated with changes in our insulin metabolism. Now, we should also know that insulin is a very, very important hormone which controls our blood glucose levels. If insulin metabolism gets altered, a person is likely to have increased risk of diabetes. Similarly, if an individual gains weight, his risk of developing diabetes, heart disease, that also goes up. And this is the reason why now WHO has come up with this recommendation suggesting that use of these agents, artificial sweeteners, for people without diabetes. Artificial sweeteners thus should not be used in our day-to-day practice. We should refrain from their uses and we should try to use natural sweet products like fruit, glucose, dates and such things.